So let's discuss about how to diagnose the knee osteoarthritis. Okay, it depends upon the assessment. When you go to your doctor, they will assess your knee joint and they order some of the tests. For example, X-ray of the knee is the most sometimes. Assalamu alaikum and welcome to our YouTube channel. My name is Dr.Syed and in this video we will talk about knee osteoarthritis. All right, and knee osteoarthritis is the most common cause of the knee joint pain, and it is also one of the reason for knee joint replacement. All right, and it is knee osteoarthritis is commonly seen in patients over 50 years, and it usually develop after the age like around 50 to 55. People usually started to develop the knee osteoarthritis due to damage of their knee cartilage. Alright, if you're new to this channel, please share this video to your family and friends and like and subscribe our channel. Thank you so much. Let's discuss about knee osteoarthritis. So osteoarthritis is a common condition, can affect any of the joint in the body. All right, it can affect the joints in the hand, especially the first carpal metacarpal joint is one of the where the carpal bones of your wrist and the first carpal bone of your wrist usually degenerate due to osteoarthritis, and it is one of the reason that's why is a commonly replaced joint also in the hand. Okay, and it can happen in the any other bone like hip joint. Osteoarthritis is quite common, and also the knee joints, which is our today's topic, is also most common joint for the replacement, and the reason for knee joint replacement is knee osteoarthritis. And osteoarthritis can affect any of the joint in our body. When a joint develop osteoarthritis, so their cartilage, their joint cartilage is getting very rough due to wear and tears. Okay, due to normal use of joint and due to the aging. So that's why that joint does not move smoothly and does not work smoothly. That causes the pain. So that's why the chances of getting knee osteoarthritis increases by normal age-related changes, which is called due to wear and tear. Okay, or any previous injury in our body, or any of your job where the physical activities is repeated activities is involved. Okay, and any physical job, and sometimes it is due to the family history, new family history, and obesity or overweight is also one of the reason for a knee joint osteoarthritis, because due to obesity, the patient, due to patient weight, movement of knee joint can be affected, and it eroded or it usually damages the cartilage in the knee that causes the knee joint osteoarthritis. And the symptom of knee joint osteoarthritis vary from person to person. Some people experience lots of symptoms, okay, and some people experience some of the symptoms, but the most common symptoms of knee joint osteoarthritis are knee joint pain, which can be worse by movement of knee joint, especially when you're walking, it causes the pain. When you're running, it causes the pain, and when you're in the severe cases, even when you are resting or when you're sleeping, it causes the pain. Like knee joint causes knee joint due to knee joint pain. Even when you're sleeping, that is one of the most common reason for knee joint replacement. If someone is having a knee joint pain when they are sleeping due to osteoarthritis, so that is one of the reason when they think, okay, Now it is the time to replace the knee joint, because knee joint osteoarthritis is affecting daily day-to-day activities of patient. Okay, and it causes the weakness in the muscles as well. Swelling in the joint causes synovitis, and you will see the uh, osteophytes are developing around the knee joint, and it causes sclerosis. It causes thickness of the knee joint, and the joint space, the knee joint is become very narrow, so it is difficult to move the knee joint. When you walk, it causes difficulty. When you walk, it causes crepitations and pain, and sometimes you can hear the sound is coming from your knee joint. And so this, because knee joint space has become narrow and narrow and narrow, and the cartilages, damages due to the damage of the cartilage, because cartilage provide cushions. Okay, that's why our joints move. There is a synovial fluid in our joint that helps the joint to the movement, but once the cartilage is damaged, it is very difficult for the joints to become easily moved. So you you feel like weakness in your thigh muscle, and cracking, grunting, and crushing noises are coming from your knee joint. Okay, so let's discuss about how to diagnose the knee osteoarthritis. Okay, it depends upon the assessment. When you go to your doctor, they will assess your knee joint, and they order some of the tests. For example, X-ray of the knee is the most sometimes helpful in the diagnosis, and you may sometimes need to have further examination and other health related condition as well. All right, so let me show you the model of knee osteoarthritis so you will understand better. So this is basically a normal knee joint. Okay, this is a normal knee joint. All right, you can see here, this is basically a femur. Okay, this is a tibia, and this is our knee joint. Okay, here you see the cartilage is quite good, and in tibia you see here the meniscus, medial meniscus, lateral meniscus, and the cartilage is in quite good position. And this is the model where the patient is started developing a knee joint osteoarthritis. All right, you see here, what is the difference? This look at the bone here, it's quite smooth, but in this model it is an early osteoarthritis. The cartilage is damaged, but here the cartilage is quite good condition. But in this early osteoarthritis of knee, the cartilage is damaged. This cartilage is damaged, and that is the reason for causing the knee joint pain. Okay, and this is here is a model of early osteoarthritis, and this model is showing you the moderate osteoarthritis. Now, initially the osteoarthritis was like this, but now it is getting worse. Okay, it is getting worse. You see the cartilage damage here and here, and also on the you see the cartilage is damaged. And this is early osteoarthritis of knee, and this is the moderate osteoarthritis. All right, you see here the thickness of bone, sclerosis, thickness. All right, there's a generation of osteophytes are developing inside the joint as well here. So this is a model of, and the last model I'm showing you here, which is the advanced model. Okay, and this patient needs a joint replacement because this is advanced osteoarthritis. You see the bone here, it's quite thick bone. Advanced osteoarthritis, these are osteophytes are developing around the bone. That causes the pain. Cartilage is almost damaged. If you see from inside, the cartilage is damaged, and the patient is having severe pain in this advanced osteoarthritis. This is a moderate osteoarthritis. This is advanced osteoarthritis. All right. So you see the meniscus, which provide the cushion of the joints movements are okay, but knee joint, you see here that their cartilage are almost damaged. So whenever the patient moves and they move their knee, they walk, it causes severe pain because there is no cushion due to the cartilage. It causes pain because of the damage of the cartilage. So this is a severe form of osteoarthritis. Okay, in this like in this model, or in this case, patient usually uh, recommend people, doctor usually recommend to go for the joint replacement, because the patient can experience a very severe type of knee joint pain, and pain even during the time of sleep, pain during the time of walking, pain during the time of doing any kind of physical activities. So this is a severe joint, severe osteoarthritis. All right. So sometimes patient needs a uh, the walking aid to help to walk. Okay, just because of the pain, and that help in climbing the stairs, or also they're advised to use the handrail, and also they advised to use the take the medications for their pain. Okay, or they initially recommend to use the ice and the heat pads or ice cubes for their pain. But if the pain is not uh, you know if the pain is not subsiding after taking ice, or after using ice or heat pad, or after using over-the-counter medication such as paracetamol and brufen, and after taking painkillers, so then the surgery is usually recommended to those patients. In surgery, they replace the damaged part of the knee, they put the new joints here. That joint will help the patients to walk, and they help to do the normal day-to-day activities. So we will do another video on the joint replacement, how to replace the joint. If you like to ask questions, we are happy to answer your any question. Please like and share our channel, and subscribe our channel, and type your questions in the comment box. Hopefully see you soon. Thank you so much.